Hi there and welcome. My name is Andrea LaFalce, and today I want to thank you for joining our Human Story program. Charleston County Public Library began our Human Story program in the fall of 2018. Typically, we would invite individuals who had been exposed to a stigma or prejudice to come and share their stories in a welcoming environment, and we would invite members of our community to join us for open, honest dialogue and learn from each other. During COVID-19, this program looks a little bit different, but I have been so fortunate in that I have been able to work and collaborate with Dr. Clayton Copeland to arrange a discussion around accessibility, diversity, and inclusion. Dr. Copeland is on faculty with the School of Information Science at the University of South Carolina, and she is also the director for the Laboratory of Leadership and Equity and Diversity. Dr. Copeland is very insightful and enjoyable to have a conversation with. I myself learned a lot from her, and I hope that you will too. Without further ado, I'm going to turn this conversation over to her. Thank you, Dr. Copeland.
Hello, everyone. Thank you, Andrea, for that very kind and gracious introduction. You are always so thoughtful, and it has been wonderful working with you to plan this event. I'd like to thank you, Andrea, and Charleston County Public Library for the opportunity to be a part of today's session and Charleston County Public Library's Human Story series. As Andrea said, my name is Dr. Clayton Copeland, and I am on faculty with the School of Information Science at the University of South Carolina. Part of my work there also entails work as director of our Laboratory for Leadership in Equity and Diversity, or LEAD. And I consider it particularly a privilege to be with all of you today to discuss accessibility, something that is very much both a personal and professional passion. Join you all remotely for our Human Story series, and this is due to the challenges we're all facing right now with COVID-19. And during COVID-19, I have spent some very cherished time with my family in the upstate of South Carolina. And I grew up the daughter of a veterinarian, and as it happens, one of the farmers in the area has this cow statue, and he dresses the cow for various holidays or significant events. So here you see our cow all prepared for social distancing. Today's conversation is one surrounding accessibility. Why accessibility is important. Why this conversation is important to have. And how we can create accessible spaces, be those spaces physical or virtual. And then finally, I'm very thankful to be able to share some tools and resources, some small changes that can really make a big difference when it comes to creating accessible environments and interactions. As I said previously, my passion for accessibility is one that is both personal and professional. My arrival in the world in 1983 came as somewhat of a surprise when I arrived approximately 3 months premature. My dad loves to joke that I just didn't want to miss anything, and so had to arrive early. As a result of that premature birth, I have faced various challenges and do use a walker for ambulatory purposes. I was, however, very fortunate to have been born to a very loving family, two incredible parents who gave so much of themselves for me. And joining them in that same dedication and commitment were two sets of grandparents who are amazing and for whom I am grateful every single day. You see, these individuals raised me with a mindset not that because I used a walker I had a disability, but rather that everyone faces challenges in life. It happens that some challenges are more physically apparent than others. But regardless of whether challenges are immediately visible or invisible, everyone faces challenges. It is through those challenges, however, that our greatest abilities can also be born. It is through our challenges that we find new abilities that may not otherwise have come to be. My mom loves to tell the story of picking me up from kindergarten, and the teacher came over and said, "Oh my, we just don't know what to think of Clayton." And I suppose I had earned my own reputation as sometimes being like Peter in Mr. McGregor's garden and sometimes getting into mischief. And Mom said, "Oh goodness, what did she do? What happened?" And Mrs. Glenn said, "No, you don't understand." She said, "Most of the children in this class, being 2 years old, are saying ball." And Clayton called me over to her today and said, "Mrs. Glenn, I would like to play with my ball, but I can't reach it. Could you please help me get it?" Yes, I faced challenges and had not yet at that time been given my first walker. And so as a result, learned to be very patient and also very observant. And as we all chuckle to this day, my verbal skills developed very early. As a result of some limitations with being able to move as quickly as others, I had developed very advanced verbal skills. Talking about accessibility is important because it impacts every single one of us in society. According to statistics from the Centers for Disease Control, approximately 1 in 4 individuals is labeled as having a disability, or, as I prefer to say, is differently able. The number of children and young people ages 5 to 15 who are differently able, and this is according to the U.S. Census, is 2.6 million. Today's communities are synonymous with diversities. We have a milieu of cultures, ethnicities, races, languages, socioeconomics, religions, levels of education, LGBTQ plus populations, various genders and gender identities, and abilities. All of these factors comprise our communities. It is up to us how we approach the diversities in our communities and how we create welcoming, inclusive environments. It is up to us to seek and to see the abilities that are within each individual. In my work pertaining to accessibility, we also look at the power of perception in the creation of ability or disability as a social construction. Perception can play a significant role in how we label differences. Are they abilities? Must they be disabilities? To give us an example here, I'd like for us to look together at the following slides. Looking at a few children. Which child does not have a disability? On this slide, we see a precious one reading a book, and he's so excited. I remember being that excited reading some of my first stories. On this next slide, we see another little girl, slightly different age, also reading. And on this slide, we see three precious little girls of varying ages and ethnicities and cultures. And then on this final slide, we see a precious little one using a walker and wearing her pink tutu as she takes her first steps. I just love that little tutu. As we consider which child does not have a disability, the true answer is that we don't know which child may also have a label of having a disability and which children do not have that label. Some challenges are visible, but others, like learning differences or mental illness or even depression, are not. When we consider ourselves and whether or not we have a disability, this too speaks to our ability to construct our own identities. I showed this same list of challenges a few years ago in a research study. Preceding this question was a question asking individuals to self-identify as having a disability or as being typically able. And I got so many entries from folks saying, gosh, in the first question I answered that I did not have a disability. But then when I looked at the list of several characteristics, I realized that while I don't ever label myself or think of myself as having a disability, I do have some of these challenges that are listed. And some of these include blindness or visual impairment, corrected vision, So the need to wear glasses or contact lenses, deafness or hearing impairment, hearing loss, a head or traumatic brain injury, mental illness, mobility or orthopedic impairments or arthritis, speech or communication impairments, neurological impairments, cognitive impairments, learning disability or learning difference, to use the terminology that is replacing the term learning disability, and post-traumatic stress, and it was formerly referred to as post-traumatic stress disorder in several diagnostic manuals. But speaking to the social construction of ability and disability, we can see here in the terminology of changing from learning disability to learning difference and post-traumatic stress disorder to post-traumatic stress, that we in society have the ability to think about and reframe how we think about characteristics and whether they are labeled as disabilities or whether they are labeled as differences to be appropriately accommodated. Again, our social values have such tremendous power. Inaccessibility places unnecessary barriers in environments, does not allow for flexibility or alternative methods for accomplishing tasks. It also perpetuates this myth of disability, less than, less able, less capable. Conversely, making appropriate accommodations and creating accessible environments can deconstruct many facets of disability. Yes, there are challenges with accessibility. Some of these include finances. Some of these include disabling environments. And others include overcoming societal prejudices and stereotypes. When we move from a mindset of disability to accessibility, some of the challenges related to finances disappear, because in our justification for making accommodations and creating more accessible environments, we can say that we are making accommodations and changes, small changes or big changes, that benefit everyone. So if we're faced with the question of, well, we're making a change for a small segment of the population, we're now empowered through universal access and design to say, well, no, actually, accessibility is everyone's responsibility. Accessibility improves access and participation and engagement for everyone, not one segment of the population, but for everyone. And we have some opportunities and some solutions. Also, some responsibilities. We can take action today by building awareness of differences in societies, but reframing our thinking to the contributions and the abilities that are innate in every single human being. We can adopt a philosophy of inclusion and focus on ability and ability born through differences. Very simple changes like modifying the way we say something can completely restructure the value system. For example, the difference in saying the disabled person and saying the person with a disability. In that way, the characteristics that are labeled as a disability are one part of an individual, but they are not the defining characteristics of the individual. They do not replace the value of the individual. We can change our attitudes to being attitudes of ones of inclusion, and instead of seeing something as a disability, seeing it as a difference. It's also very important in any interaction with any human beings to avoid assumptions and instead to approach new opportunities, new sets of circumstances with an open mind. Speaking from my own personal experience, I can say that because I had the need to use a walker, before people had the opportunity to have an interaction with me or to have a conversation, to allow me to show them who I was, there were times in my life where, again, based solely on the visual of seeing me ambulate down a hallway, that folks could assume, or would assume wrongly, that because there were physical challenges, there may also be other challenges involved. For example, cognitive challenges and so forth. I did graduate from high school as valedictorian of my graduating class and president of my student body and the Student Government Association. I went on to complete college and then graduate school and then a PhD, Doctor of Philosophy, in Library and Information Science. I say all of that today not to come across as bragging on oneself, but simply to illustrate that assumptions can very quickly lead us astray. And we can avoid making incorrect and unfair assumptions by continuing our learning process, formally, informally, in pre-service education endeavors, and on-the-job training. We can also take immediate action by employing values and principles of universal design. Now, universal design is a set of principles that originated in the field of architecture and apply most prominently to the built environment. But universal design can also apply to any other environment, including the learning environment. Very simply defined, universal design involves making small changes to benefit everyone. And so you see here in the puzzle pieces that universal design accommodates physical abilities, age, skills, variety of experiences, preferences, strengths, cultures, learning styles, languages, perspectives, senses, and even religions. Universal design ensures that any culture, age, size, weight, race, gender, ability, and I'm sure we could insert other diversities here as well, can experience an environment that promotes their health, their safety, and their welfare today and in the future. When making a case for universal design, we can say that universal design ensures safety and security for all. Economically, it's cost efficient over time because, again, we're making changes that benefit everyone. And environmentally, we're creating circumstances that are resource efficient. When we think about our concepts of ability and disability and how those labels are assigned, let's think for a minute about an individual who wears glasses or contact lenses, for example. Do we automatically give that individual the label of having a disability? Why or why not? Gosh, I would love for us to be together now and having this conversation together. I'd love to hear your thoughts. Actually, we don't, as a society, label everyone who wears glasses or contact lenses as having a disability. We don't because through glasses and contact lenses, appropriate accommodations are made. The playing field, if you will, is leveled. And so we have the power as a society to create levels of inclusion and opportunities for accessibility. There are so many things that we can do to make a difference. In framing today's conversation, Andrea and I spoke about some of the many things that can be done to create a more accessible environment. If you'll think with me for just a moment to a physical space. Creating a more inclusive environment can be something as small as moving a piece of furniture to make a wider pathway or area of entrance and egress for someone who may be using a mobility device. It may include providing, without being asked, handouts and printed materials in multiple formats so that they are accessible for and usable by multiple populations. So for example, we could have a handout with a standard size font of size 12 font, but we should also have available a large print version of that same handout. If we're accommodating for visual challenges, for a handout, a size 18 font is considered the suggested minimum and required minimum for accessibility. Thinking more broadly with technology accessibility strategies, some things that we can do, all of us, immediately, include changing our default settings on our technologies such that when we send or receive an email message, for example, we're using a minimum size font of size 12 and using sans serif fonts, so fonts that do not have the serifs or the little tails on the ends of letters. Examples of sans serif fonts include Arial, Verdana, Calibri, and others. Making that small change may initially be considered an accommodation for someone who has a visual challenge, but it can also be thought of as making material more readable for everyone, regardless of visual acuity. Again, for handouts, font sizes should be at least a size 12 font. For presentations, fonts should be much larger. And again, for a visual challenge, something that is held at the distance of a handout should be a size 18 font. For presentations, font sizes should vary, but should be no smaller than the size 24 range and up. Using bold to display emphasis rather than color can also be very important. This eliminates barriers when someone has various challenges, whether labeled as having a disability or not, with color distinction. So using bold to display emphasis can mean avoiding trouble that we all have with seeing certain colors, whether those are our neon colors that are more difficult to read, or red and green, which can be difficult, for example, for some forms of color blindness. We also need to create accessible documents. And when I refer to creating accessible documents, that means changing the structural integrity of a document, the code of a document that we do not necessarily see, such that assistive and adaptive technologies like screen readers that read aloud the text on a screen for a user. So the creation of accessible documents, the use of headers and subheaders within the structural integrity, the code of the document, means giving the screen reader directives on in what order and in what direction to read text aloud. So much as those who are sighted would be reading a document from left to right, top to bottom, those who face various visual challenges as well as print disabilities, or simply those with learning styles that mean they have a preference for hearing text rather than reading it. Creating accessible documents can be helpful to everyone. And I'll show you some strategies in the coming slides for creating accessible documents and also checking those documents for accessibility. To illustrate the point of font considerations, on the screen here I have several commonly used fonts. As it happens though, none of these fonts would be considered accessible. None of these fonts are sans serif fonts. In terms of creating accessible documents and creating the structural integrity of a document that will allow for the document to be accessible for screen readers, for example, I'm very excited to say that on both the Windows platform and the Mac platform, we now have built-in accessibility checkers. And so when we create documents, we can immediately go to these built-in accessibility checkers, and what we will be given is a list of all of the accessibility barriers in a document. For example, does the document have headings and subheadings to direct the order in which the document is read? Does the document use alt text, alternative text, to provide a description of all images, charts, tables, and graphs such that someone who is unable to see the screen is able to have a visual description of the image, chart, graph, etc. Here on the screen I have some instructions for you for accessing your accessibility checkers. In earlier versions of Microsoft Word, you would go to File and then Info, check for Issues, and check Accessibility. In later versions, we can now just simply go to the Review tab and check Accessibility. And again, we will be given instructions not only on what the limitations or accessibility failures of the document are, but instructions on how to correct the document such that it becomes accessible. There's a disclaimer here that an accessibility checker may not catch every single error in a document, but it provides a solid foundation and making an effort, something we can all do today to make inroads toward increasing accessibility. Other things that we want to keep in mind are assistive technology devices. Now, this definition comes from legislation for K through 12, kindergarten through 12 age children. And assistive technology devices are defined in idea as any item, piece of equipment, or product system, whether acquired commercially off the shelf, modified, or customized, that is used to increase, maintain, or improve the functional capabilities of children with disabilities. The term does not include a medical device that is surgically implanted, so for example, a cochlear implant, or the replacement of such a device. Assistive technologies can include aids for daily living, communication, computer access, education, hearing, recreation and leisure, seating and positioning, and vision, just to name a few. We all use assistive technologies every day, whether we realize it or not. Think about, for example, our remote controls for our televisions, keyless entry into our vehicles, a pencil grip, a pillow for seating or positioning. Just a few that we all use every day. Now, one of the final questions Andrea asked for me to address today is some resources and technologies that we all could use to create more accessible environments. So I have on the screen here for you links to several different resources. One is a very robust screen reader called a Kurzweil reader. Another is Zoom Text, which allows for magnification on a screen. And then finally, Bookshare, which offers us alternative electronic access to books and materials. Here also on the next slide, I have some resources on how to use some of the apps and resources within an iPad to work with populations experiencing autism. And then I have some information for you here and links depending on your operating system to access the built-in assistive technologies that are available in your operating system. So this can include, for example, screen magnification, as well as screen readers, sticky keys, which is a feature that can be used by anyone experiencing hand tremors or limited dexterity to have to press harder on a key and therefore avoid inadvertently or erroneously striking a key on the keyboard. So again, all of your built-in assistive technologies are available depending on your operating system. They even include features for learning differences and cognitive variations such as learning differences, and tools and resources that can help us block out background programs and increase focus as we're using our technologies and devices. With much appreciation to Madalena Tudora with the South Carolina Department of Education, I also have for you here an electronic binder of resources that you can use. And so for parents or caregivers or families working with various diversities, you're able to go in and look at some of the technology tools and resources available to provide support. Also, state and national resources. We at the Laboratory for Leadership in Equity and Diversity are always available and want to support you and your colleagues and loved ones in any and every way possible. Our focus is equity of access and accessibility of information, both in the physical and electronic or virtual environments. I've also linked everyone here to the Linda Lucas Walling collection for universal access. This collection is a demonstration collection for and about children with disabilities. The Linda Lucas Walling collection for universal access was established in honor of Dr. Linda Lucas Walling, faculty professor emerita with the School of Information Science. For those of you who may not be familiar with Dr. Walling, she is a scholar and is a pioneer in the areas of library accessibility. And upon her retirement from a very distinguished career, a group of former students wanted to establish this collection in her honor. Dr. Walling has published many books and articles relating to accessibility. In fact, one of her books, The Disabled Child in the Library, published in 1983, received recognition from President Reagan. Her major premise is that it is not always special format materials that create an accessible environment for a child. Rather, what can create an accessible environment is the ability of the well-tooled librarian, parent, family caregiver, or educator to present the material in a way that it is accessible for the child. The Walling collection, again, is a collection of books for and about children with disabilities, and its website is in the process of being updated constantly, but we have added there on the website evaluations of various children's books, and we have highlighted information about the specific ways the books are accessible and the ways that they could be modified to be made accessible when a certain challenge is presented. The next resource I'd like to share with you is South Carolina Talking Book Services. This is South Carolina's division of the National Library Service for the Blind and Print Disabled through the Library of Congress. And these programs provide materials in accessible formats for populations with visual impairments, blindness, and also other challenges. In some cases, individuals with learning differences and other print disabilities may qualify for services, which again provide electronic access and audio recordings to materials. And one thing to keep in mind with the South Carolina Talking Book Services and the national counterpart is that your librarian can serve as the certifying individual that someone qualifies for services through South Carolina Talking Book Services or the National Library Service for the Blind and Print Disabled. There are a few exceptions to that. For example, if someone has a learning difference, a challenge that is not visible, then a medical doctor must be the certifying individual. But in many, many cases, the librarian can serve as the certifying individual that someone qualifies for services. And there are links for you here to both of those programs as well as an application for service. The South Carolina Assistive Technology program is through the University of South Carolina's School of Medicine. They have an incredible team there and are available to provide one-on-one consultations for individuals who come to them, and they will work with individuals to identify appropriate assistive and adaptive technologies for any of the categories we've discussed previously. And they do even have an equipment loan program such that if someone wanted to use equipment for a few weeks prior to making a final decision on purchase, that is available. Learning Ally is also formally recording for the blind and dyslexic, and they provide accessible formats of textbooks for populations needing recorded access to materials. So those are just a few of the many, many resources that we can use to increase accessibility. I want to thank you for your time today. Thank you for your commitment to making a difference one day and one person at a time. It has been a true privilege to be with all of you today and to have a conversation surrounding how we can create ability and how we can create inclusive environments. I recognize that not everyone will necessarily agree with all of the viewpoints that I have shared here, but I thank you for your interest in listening, and I look forward to continuing the conversation and to helping you and those in your community in any way you may be hoping to find support, particularly in the areas of information access and accessibility. If there is anything that I can ever do to be of support to you, please always reach out. And thank you. Again, I look forward to continuing our conversation and continuing the opportunity to also learn from all of you and the value in your perspectives.